keeping an eye on imaging. Discussion and commentary based on articles from JACC, Cardiovascular Imaging.
Hello, I'm Mort Kern at the University of California, Irvine, here speaking with Dr. Jim Goldstein for JACC Imaging in our session on ion imaging. And I'd like to welcome Dr. Goldstein to us. He's a superb and well-known interventional cardiologist from William Beaumont Hospital in Royal Oak, Michigan. Welcome, Jim.
Thank you.
Jim's here to talk to us about this spectacular new study called the Spectacle Study. I'm going to just read the title to us. It's called The First in Human Experience with a Catheter-Based Near-Infrared Spectroscopy System for Detection of Lipid Core Plaques. And this study is the results of the spectroscopy assessment of coronary lipid multicenter trial. And you are among a list of very prestigious co-authors, and I'll just list them for us so we can hear. These include Dr. Waxman, Dixon, Allier, Moses, Peterson, Cutlip, Tardif, Nesto, Muller, Hendricks, Sum, Gardner, Goldstein, Greg Stone, and Mitch Krukoff. And this is a really first-in-man, very important study. Jim, could you just summarize briefly and tell us what we know from this study?
Let me start with the reason that this technology was developed, which is the search for the vulnerable plaque, which we believe is the major precursor to heart attacks, which occur without warning and present catastrophically with sudden death and massive heart damage. And the focus has now moved beyond the flow-limiting narrowings that we know how to treat in the cath lab with stents to trying to detect these threatening plaques before they produce these catastrophes. Pathologically, it's been well validated that at least one precursor to these disastrous events is what's called a thin cap fibroatheroma, and a major component of that is lipid. And the purpose of this technology is to use the approach that chemists have been using for decades to identify chemicals, which is spectroscopy. And what this catheter consists of is an IVUS-type catheter that's in a monorail-type system, looks like an IVUS catheter, operates like an IVUS catheter. You put it over a wire and then do a pullback. And instead of the catheter spitting out ultrasound, it spins out spectroscopic light trained at linoleic acid, which is the major chemical constituent of cholesterol and plaques. It pulls back through the artery and produces a map of the vessel from the distal to the proximal end, and lipid core plaque shows up as bright yellow plaque. This has been validated in autopsy studies and shown to be highly accurate in the detection of lipid core plaque. The study that we're discussing today was the first in humans, where this catheter was put in patients over the wire in a vessel that was undergoing a stent for a proven flow-limiting narrowing, and a map of that vessel was created to see if the kinds of pictures and signals we got in patients were similar to those that had been validated by autopsy histology. And in fact, that was the simple major finding of this study, is that the signals obtained in humans were exactly the same as the lipid core signals obtained in autopsy-validated lipid core plaques.
Well, this is fantastic, because now we have a method to look at the chemical composition of the vessel. Now, where do you think this is going to be applied in a clinical fashion, or can we apply this data at this time in a clinical fashion?
Well, I think the big picture is, what do we need to characterize a vessel to treat above and beyond just putting a stent in the obvious critical narrowing? How do we know the length of vessel to treat? So if you break it down into those flow-limiting stenoses that you're going to treat, and then other lesions that you might or might not see angiographically that you worry about, because we know, especially in acute coronary syndrome patients, that even if you treat the culprit lesion and you give appropriate risk factor reduction medicines, aspirin and statins, et cetera, there's still a 22% event rate over the next 18 to 24 months, because these patients have multifocal plaque instability. They have multiple TICVAs. They're inflamed. They're hot. They recur. And we really want to be able to find those other lesions that aren't angiographically obvious. So the potential applications of this technology, and it's early, and studies must be performed to really establish the best way to use this technique. But what we've been doing in patients thus far in our early work clinically is is looking at patients who have critical narrowings that we're going to stent. And the vast majority of those patients have contiguous diffuse disease, sometimes relatively mild. We want to limit the amount of stent we put in. We want to cover significant disease, but I'm not sure what significant is anymore. It's not just the angiographic significance. We want to avoid putting stents across side branches, et cetera. So we've been using this technique to map out the length of vessel that has lipid core plaque, often using with an architectural technique like IVUS to look just beyond the angiographic luminogram of narrowing. And we found in a significant number of cases that we've put in a longer stent than we thought we would have based on the angiogram, or sometimes a shorter stent because we found a discrete zone. And so it's helped us with the length of vessel to stent. We're now picking up remote lipid core plaques that might have been moderately narrowed that we might have left alone, then doing IVUS. Often we'll do coronary blood flow determinations to really add what I call the ABCs of plaque determination. You want to know architecture, you want to know biology in terms of inflammation, you want to know composition and coronary blood flow to really produce the total data package so that we begin to really characterize plaques and then do the prospective studies necessary to really find out how to use this.
This is fantastic information. I want to thank you very much. I look forward to the clinical outcome study. I hope to be able to participate as well. And I want to thank the listeners for tuning in to JACC Imaging Conversation and Eye on Cardiology.